Dr. Roskies is here. I'm going to pull him on. And honestly, this is just about education. He's such a natural educator. So we're so blessed that he'll hop on and give us just a great perspective. So I'm so excited that we could do this tonight. So as soon as there he is. So as soon as he gets his video on, you guys will meet the man of the hour. He's become kind of TikTok famous. Let's see. I think it's his first time on TikTok. So we're going to wait until. Hi.
It's my first time. I'm sorry. Hi.
How are you? It's so good to see you.
Good. How are you? It's so nice to see your beautiful face. Look how good you look.
Right? We made a good team.
Pretty unreal.
Teamwork.
I think we are. We are the dream team, like I've said.
Right. He's left me hanging. High five. Boom.
I got you.
Right?
I got you. There we go.
No, it is. And honestly,
I didn't think I was so technically disabled. Okay, we're good. I'm good to go.
No, it's so great. So yeah, everybody's talking about you on my platforms. It's actually been amazing to see how many people are so thirsty for knowledge. So when you reached out and you said that you'd love to be part of the education process, this is exactly what our women at our age need, because there are so many fears and we're so excited. So I actually hopped on a little early. I have so many questions for you that come from the people here. But this is Dr. Roskies. He's from Toronto. I searched high and low. I researched like it was like leaving my kid to someone in my will. Like I researched him. I challenged. I tried so hard to basically rule him out. Like I told him too. I'm like, listen, I tried so hard not to pick you. And it really, you guys know how deeply I researched. So I just happened to end up with truly who I think was perfect for me. And I'm so thrilled. Now, he did his part, right? Which we can talk about what he did for me. I came into it 100% like, listen, I've been preparing like this, like an athlete. Like I want to be your best recovery case ever. And so I really think,
You probably are.
Oh, and I really think like if you go into it that way as a partnership with your surgeon, I think that there's just such an amazing way that you can get on the other side of it. And I think it has to work that way. It's not a one-way street. So this is Dr. Roskies. I'm going to tell you a little bit about why I picked him. He's in Toronto, and which for me, I didn't go to Toronto to save money. Let's get some things off the table. I didn't go to Toronto to save money. I didn't go to Toronto because I live in Toronto. I went to Toronto because I picked him. And I paid full price for the surgery, and I'm not getting any referral fees. This is purely to introduce you to the concept of facial plastic surgery and get you some really good information as you go through the journey if you're considering it. So all of that's off the table. So hello.
Yeah, I think that's a good thing to clear. Good.
Yeah.
Good to clear there from the beginning. I will say this from the beginning. You said you tried everything in your power to rule me out, and as a surgeon, I try to do the same with my patients. I try to tell them every reason why they shouldn't go forward with surgery, and yet still, both you and I decided to move forward, and it really does speak to not just the partnership in going forward with surgery, but it really is a shared partnership, and it has to be a match. Not every surgeon, not every patient is going to be a match with one another. And it just so turned out that, we clicked really well. I think, certainly your anatomy was really prime for the surgery. You obviously have taken really great care of your whole body and your skin for a very long time. So it's paying dividends right now. So I'm excited to talk about all of that right now.
Yeah. And I think, one of the big things that I loved is, what I learned through the process was the evolution of the deep plane facelift, how it went from the deep plane facelift to the extended deep plane facelift. And now there's this not new, but something that's really evolving, the preservation facelift. And I think the one thing that really impressed upon me is you were one of the authors of the introduction of this preservation facelift. And I think they called it the Roskies patch, the way you actually do the neck technique. And my facelift was a deep plane preservation facelift. And the fact that you were kind of, one of the contributors to that whole concept was really amazing. It really said, and I think you are on the younger side of surgeons, but so innovative in taking a look at it and saying, this is the way the facial anatomy moves best, heals best, and creates the least amount of dissection. And I loved that. So congratulations on that. That is such an amazing accolade for you.
Thanks, Christina. Yeah. I often say there is no better time to be a facelift patient, and there certainly is no better time to be a facelift surgeon, because our technique has evolved to the point that we can do whatever we want. We're pretty good with a face. And so we've turned our attention to potential complications and recovery for patients so that we're not just focused so much on outcomes, but we're also focused on the entire experience for our patients. So preservation facelift, which is a modification to the deep plane facelift, just as you said, was born out of myself and a group of surgeons who I respect and admire all over the world coming together to say, we think we can do this a little bit better. It's good now, but it can be even greater than that. And so we wrote that paper 2 years ago.
And who were the other contributors? Because they're really big names as well.
Yeah, they're incredible guys. So Mike Nyack, who I'm sure everybody knows, Dominic Bray, who everybody knows, Alessandro Gualdi is a surgeon in Italy, Ben Talay, who everybody knows, and Neil Gordon, who is less visible on social media, but in the facelift world is one of the giants. So for me to contribute to that paper and to be the first author was, a huge honor for me and definitely a springboard for my career, no question.
I loved it. So that was a big thing for me, is just knowing like that level of credibility from an academic research perspective, in addition to the practice that had to go into you contributing to that paper. That was significant for me because I'm an academic. So to know that there was that blend of not only being a practitioner, but that level of publishing and academic was a really big decision for me. Then we had the consultation. And honestly, I went into it and I said, I want an upper bleph, I want a lower bleph, I want, all this shebang. I want the lip lift, I want this other stuff. And then actually before we went into surgery, I was like, what if I want to do something for my, I literally went in there and I was like, let's just get it all done. And one of the things that was really important to me, which you almost get carried away when you get so confident in the surgeon, is that one of the things that was important to me is that I picked a surgeon that had a level of restraint to make sure that it was as natural as possible. So you really held back on some things that I was willing to do. And we didn't end up doing the lower bleph, which I've been told so many times, I needed one. I didn't end up doing the lip lift, which we said maybe in a couple of years I changed my mind. We talked about the nose, we talked about all this stuff, and I'm so happy that there was that level of restraint.
100%. Plastic surgery is just, it's a Goldilocks phenomenon where you have to understand how much is too much and how little is too little. And it's those, thousands of decisions that we make in our original consultation and discussion that lead into the 1,000+ decisions that we make in surgery that, make a result good to great. And that's really the difference, is making the right plan for the right patient. And for me, the thing that stood out in our consultation is, you're absolutely right. You are probably one of my best informed patients ever. You came prepared with your notebook. You knew exactly what you wanted, and you had done many consults before. But I think, if I'm not mistaken, my consult was the first one where I turned to you and I said, why do you want that procedure? What is it that you're hoping to achieve with that specific procedure? And we came to learn that, some of the procedures that you were looking for might not have addressed the concerns that you had. And that's why we didn't do them.
Right. And I love that. You really even turned it around to me and you're like, why don't we do something about the ptosis repair, which is something that I've had since I was 16 years old. And didn't even present it as a problem. But you turned to me and you're like, you have a bit of a ptosis repair. When I see the lights, he goes, I only see the bottom of the lights, not the top of the lights. Is that what it was? You only see the bottom of my makeup lights.
Right, exactly.
So I knew that you had a really keen eye for some of the small adjustments that could be made, which made a big difference. My biggest thing was lower face. And I already knew you were an expert there. So for me, it was a bonus that you did some of the stuff that you did to really bring the volume back, and correct the eyes. I love my eyes more every single day. They are so open and beautiful now.
That's right. Your eyes are my favorite part. They were complicated. You had a lot of, and let's be clear, you are not yet fully healed. There is a lot of time for the swelling to come down, and some of that asymmetry that we saw before might come back. But if it looks this good already, then those are great signs pointing to a beautiful recovery. So I worked really hard on your eyes. I got a comment, I can't remember, on one of the videos where they said, we noticed that the lower eyelids look a little bit better supported. And I went into all of the technical details because somebody just dismissed that as swelling, and it's not. I focused on every single detail imaginable when it came to your face, as I do for everybody, by the way. But, that was, for me, one of the priorities is, the neck is always something that is reflective of a great facelift. So to do a great facelift, you have to go do a very good brow and temple lift. And I know you got lots of questions on that, so we'll talk about
A
that as
lot.
well.
Yeah, we
But
want to talk about my
that's right.
procedures for sure.
That's right. But the eyes for me, those are the details that really differentiate again a good result to one that's really
And to
beautiful.
the detail of, you were even looking at like the water line at the top that you're like, it flips a little bit, so we're going to adjust that. So the number of changes that you made to my eyes were just a tiny, like a bunch of tiny little changes that really just turned out to be like, it really emphasizes my eyes. Now, full disclosure, I looked in the mirror every day before the surgery and I loved what I saw. So, I mean, I didn't love the laxity, but I never had a problem feeling beautiful with before the facelift. So now I'm just so thrilled that that it really has. And that's not that I don't like, sometimes I'll email the Roskettes or I'll email you and I'll just be like, oh, listen, I have a little bit of swelling here. So it's not that I don't like kind of like dip into like, all right, is this all normal? But
Mhm.
I do feel like every day is better than the last. And I think that that's been huge for me. And I know you said that wasn't going to happen.
Yeah, a lot of people do get a little bit of regret. There's always one or two things that give a bit of anxiety, especially after the major swelling has subsided and, people are back at home and real life resumes and they're like, wait, I'm not ready for real life yet. I don't feel like I look like myself. And so they focus on those small little things that might prevent them from getting back into real life. And that sometimes detracts from the positive global result that we're seeing in front of us. So, attitude is half the battle here. I
Yeah.
think you said something which resonates with me, and it's such a positive indicator of success after surgery is you liked the way that you looked in the mirror before. You weren't counting on the surgery to change anything substantial in your life. If anything, I say this often, a sign of success for me in surgery is that my patients look less in the mirror. They don't even think about it anymore. So
Yeah.
that's a really important aspect that you bring up.
Yeah. And now it's just like, whether I'm wearing my hair up, like my new neck and jawline, I'm absolutely obsessed with it. I don't focus on these platysmal bands that were, just starting to really be so prominent. I haven't worn makeup since I had the surgery just because I'm protecting these little baby fat cells you gave me, like,
Yeah.
like they're little
Yeah.
cocoons. And I feel like, it's kind of like, 15 years ago when you felt like you could wake up without makeup and still look vibrant and great, which you start to lose as we start to lose all kinds of things in the aging process and we approach menopause.
Yeah, 100%.
Yeah.
I went into this, in a time where facelift surgery was seen very much as vanity and only for, people in their 60s who were retired and going into a different phase of life with lots of money. And the truth is, we're trying our best with everything that I post online. And thanks to you, frankly, Christina, for sharing your story.
Yeah.
People see this now less as a form of vanity and more of a self-preservation of really just trying to, take back control the things that aging and gravity are taking from us and just moving on with our life after that.
Yeah. So let's talk about what you did to me.
Okay,
What, by
let's
the way,
do
when I was under, you said you'd give me 10 years back. I think you gave me a little bit more.
it. Under promise, over deliver. That's what we always say.
Definitely.
So what did we do?
And by
So
the
we
way, for
did.
everyone who's new here, because so many people are hopping on, I'm 19 days out from a deep plane facelift with Dr. Roskies from Toronto, Canada. So you've been a bit of an internet phenomenon over the last couple of
That's
weeks for
great.
sure. Did you think it was going to be this crazy?
I had zero clue that this would ever happen in my wildest dreams. It's unreal. It's unreal.
Yeah, it's been amazing, but it's really opened up the conversation. So I love that. And again, we're so grateful that he's here. So tell everybody what you did. There's a lot of confusion, myself as well, because I just
Yeah.
trusted you on the brow and
Yeah.
everything else.
Let's start off with what I didn't do. And,
Okay.
I think this is an important thing from an educational standpoint is number one, there is no such thing as a lower face and neck lift. Number two, there's no such thing as a neck lift. So when people come to see me and they're over the age of 30 and they had a good neck to start off with and they're starting to see it deteriorate, then there's really no such thing as addressing the neck in isolation by just tightening the muscle here and here. Because you can put a belt onto this region, but until you add the suspenders and reverse the effect of aging, you are really not going to get a great result. It might look good temporarily, but if you're addressing any aging component to the neck, we're lifting vertically against gravity. So in my practice, and it's not the same as everybody, but I've just evolved over time to understand that sometimes doing a bit more surgery is actually more natural. And what I mean by that is we don't do a lower face and neck lift. We don't address just the temple or the upper 2/3 of the face. We address the entire face at once. So
Yeah.
we're doing a brow, temple, face, and neck lift. So that's what we refer to as canvas surgery. When people age, it's not just muscle descent, it's also volume loss. So we talk about the 3 Ds of deterioration, which is descent of muscle, deflation of fat, and deterioration of skin.
Which
So
all
you
ended
took
up
care of
right
this.
here for me. Hmm?
Yeah, I mean, it looks amazing, but you took care of the skin portion of that. We'll talk about the halo laser afterwards, but you needed very little on that front of things. Descent of muscle, you can't outwork, you can't outdiet a jowl, you can't work off a nasolabial fold. These are things that only a scalpel can solve, and that's really lifting things vertically. And then we did fat transfer, which was restoring a very small amount of deflation that you had, but for me, so far, it's really led to so much youthfulness that we see in your face because it's adding highlights and shadows in a way that, just muscle repositioning can't establish. So that's really the beauty of fat transfer. We did an upper blepharoplasty. So that's an incision in the upper eyelid, removing the skin in that region.
And I think you said you only took away one
centimeter.
centimeter?
That's right. So 10 millimeters of skin is probably about my average, maybe a little bit below that for your age group. We don't go into the surgery with any preconceived idea of how much we have to remove. I'm measuring exactly the distance from your eyebrows to your lashes. And that's what I want to preserve because we want you to close your eyes. So we remove as much as possible. And then whatever is in between those two lines is what we remove. In your case, it just so happened to be 1 centimeter. And then we went on the inside of your eyelids to do a ptosis repair. Ptosis is essentially a relaxation of the muscle that is responsible for lifting up our eyelashes and our eyelids as well. And so, there are many causes to it. You had said to me that you always had it, but it's getting a little bit worse with time. So this is a very small adjunct. I love it as a procedure in combination with blepharoplasty. And over time, you're still a little bit swollen now, but we can already see the improvement. But over time, we just see the eyes look less sleepy, more bright as a response to that. And it has that really, beautiful impact on not just the person's, youthfulness, but also their identity because it restores that back to the way that it used to be. And then we also did an earlobe reduction as well, which was...
Yeah, I miss my hoe hoops.
Yeah, they'll come back. Don't worry. We'll get those back.
And then the fat transfer. When you really took a look at the fat transfer, where did you put it?
So fat transfer, as I always do, we did a little bit to the mid-face. We did to your lateral cheeks. Because when we lift brows and remove skin, there's a risk of hollowing of the upper eyelids. We actually placed some fat transfer into the upper eyelids as well. Many people have these little dips near their chin. This is a ligament that's very strong that kind of forms as the muscle falls down. So we lift up, but we also place a little drop of fat transfer just into that little crevice over there. And a little bit into your temples and your forehead as well. Those were the regions that we placed fat.
Yeah. And honestly, that was one thing. And I'm glad we had that conversation about the fat cells needing their own blood supply and what you eat makes a difference and protein and all of those things. Because I really, listen, I don't take direction and follow instructions by many people at all. But when Dr. Roskies tells me to do something, I'm like, yes, sir. Just because I'm so protective of it.
Totally. Yeah. Fat is one of those finicky things where, we often say that it's the cherry on top. So the lifting is the power horse here. This gets you the majority of the lifting, but the fat really does bring the result all together. So, at best case scenario, the fat survives and we see really beautiful volume. But at worst case, if it doesn't survive, at the very least, it shouldn't take away from the results. So, fat is a difficult topic because, I saw 5 people at 1 month follow-up today alone, and every single one asked me, did my fat survive? Is my fat surviving? And we didn't, of course, it's too early to tell that, of course, but I try to re-emphasize or de-emphasize the importance of fat transfer because it really is just a small incremental percentage. But just as you said with the eyelids and with everything else, those millimeters matter. Everything matters. So it's small little changes that add up to one beautiful thing in the end.
Yeah. So many people have commented on my posts and everything saying this is one of the best facelifts they've ever seen. And I agree. It's actually my favorite facelift that I've ever seen. So
Good, I hope
I
so.
love it. And
Yeah.
honestly, I don't think it was accidental. I think, do you remember during the surgery, I had talked to you very openly about some of the other surgeons that I had talked about. And I had talked to you very openly about some of the things that bothered me. And you were really kind to like walk me through some of the ways that I can interpret, some of the cosmetic
Yeah,
outcomes. And one of the things that I said to you
totally.
is I don't want like I love some of these surgeons' work, but I don't want a strong jawline or I don't want
Hmm.
contours that I didn't have before. I don't want to change that much. And,
Yeah.
and I think I probably talked to you about it 3 or 4 times leading up to the surgery that like, I don't want a heavy lifting jaw. I want a Pilates jaw. And
Totally.
I think that the communication that you and I had, I think I went into it knowing
Hmm.
exactly what I wanted. And I think that that two-way conversation was so, so important. And I think
Of
that the
course.
outcome is not an accident when you have the right skill, the right skilled hands, the right preparation, and
Hmm.
just really good communication.
Yeah, 100%. This is something that's so important to me. It's why our consultations are an hour and 15 minutes. Like we sit and we spend
Yeah.
time and we listen to what you want. It's not the same surgery for every single person. And it's not an assembly line where I'm seeing, 20 different consults a day. I see 5 consults a week. And it's because we spend 6 hours talking to people about not just what they want, but what are their motivations, trying to understand how we can, achieve whatever outcome and to meet whatever expectation they have. Sometimes that's not always possible, of course. So we might decide to part ways before the surgery even happens. But, there were so many things that you said that resonated with me. And the biggest one was, for me, and I give Elizabeth Chance, who I think is probably the greatest facelift surgeon in the entire world, credit for this, is she has spoken very openly about the fact that in the past she would have, achieved what most surgeons would say is, the best in surgical skill set and acumen by doing whatever she wanted to do to a neck. But when she really looked at the results, women lost their femininity. They became almost more masculine and sculpted. And so, listening to her speak and seeing it in my own patients as well, over the last, many years now, it has really been a focus of restraint and really emphasizing the beauty of, our patient's own anatomy. So just because you can doesn't mean that you should. And so it really is a question of, creating contours instead of really strong sculpted angles. It's just not my look.
Yeah. And that was really important to me. And, there were some doctors that if I did want to really change some of that, they would have been a better fit. And I think that those types of things are really, really important. I built a crazy algorithm that basically, and I showed Dr. Roskies some of the ways that I really analyzed, overanalyzed, put him to the test. And, finally he kind of always came out on top. And I think that the biggest things were, certainly the neck work. Your neck work is just stellar. I think it's probably the best in the industry. And I really, really think that, when you really take a look at some of the ways that you were able to just make these little tweaks to your eye for aesthetics was amazing. So, and I think the biggest thing that I really kept putting into is I needed you to be one of those surgeons that had the restraint, that you weren't looking to, do that. And honestly, he checked all my boxes. So.
Thank you.
So let me put up some of the questions that people are asking. We have a
Sure.
bunch of questions for people. So let's talk about age. So some people are saying, what is the right age? Should I do a mini and then wait until 60 something years old to do a deep plane? Should I do it in reverse? When you take a look at kind of the ideal, what do you think? And some people are saying, should I do it in my 40s?
Yeah. So there, it's a very hot topic. Obviously, over the course of my career, my average age has gone down significantly in my facelift
Yeah.
population. When I started, like I said, it was in 60s, and now, actually trended after COVID into probably late 40s, and now it's back to 54 over the last 2 years. So that's really the average age that people will come and see me for facelift surgery. I think that, there's a question of anatomy, and there's also a question of person. So when we talk about anatomy, like what is the most primed anatomy ready for surgery? And it's a balance. So age is, one of the things, but it's really a question of understanding that the person still has to have some signs of aging. You need to see something in order to determine success from surgery. Otherwise, how are you measuring the outcome? So for me, like, preventative facelift surgery is just not a thing, because what are you really doing to that person other than putting them through a little bit of pain and misery to not see any result, but say, don't worry, it's going to hold you for many years. I just don't believe in
Right.
that. So, once we've established that there are some signs of aging, then we have to ensure that they're not so far along the aging spectrum that they have a strong enough muscle to manipulate and to pull with a good amount of force, that it doesn't tear or shear or doesn't hold the result that we create when we're in surgery. So usually that is before the age of 60. After the age of 60, there are, small concerns that that muscle, which, in younger patients is more like a thick piece of cardboard paper. And as we age and that muscle gets saturated, it's like a piece of smoked salmon or wet tissue paper. It's kind of like the analogy. So even putting stitches through it, those stitches might not hold very well.
Wow,
So
that's
what's the sweet
amazing.
spot? It's kind of mid-50s for sure, I would say. And that's because we're seeing those signs of aging, but that person is not just, strong in the anatomy standpoint, but they're usually healthy enough to withstand the nature of the anesthetic and the surgery, and to really, do very well through recovery. So that's number one. In addition to that, we also look at people who have good skin elasticity. So past the age of 60, you lose elastin. Obviously, that's why we're doing the surgery, is to, improve and to take away the quantity of your skin, but we can't always change the quality of your skin. So if we create a beautiful framework and we get a little bit of swelling underneath the chin or in the cheeks after surgery, we rely on that elasticity of the skin to shrink wrap on top of the framework afterwards. So if you're old enough to not have that great elasticity, it's not to say you shouldn't have a facelift, obviously, but we have to set expectation a bit more realistically. So that's the anatomy side of it.
Yeah.
Personally, just really quickly to touch on it, life is about, risk benefit calculations, and you just really have to analyze what the benefits are for you. So we have to see a true benefit. We have to understand what the risks are, not just in general, but the specific ones in your case. And then you have to use the barometer that I mentioned to my patients to tip the scales towards either doing it or not. And that is, how much is it bothering you? And so
Right.
that personal decision really, factors into whether or not you think the risks are worth it in order to achieve the benefits.
So a lot of people are asking, I'm already 60, I'm 62, is it too late?
Yeah. Absolutely not. It's still, a very common age for us to treat in facelift surgery. The good news is, when those people were in their mid 50s, techniques were just not great enough to probably achieve what they're looking for. So they're still in an excellent time of the world in order to have a facelift and to get a better result today than they probably would have 5 to 6 years ago.
Yeah.
So that all being said, again, it's very patient specific. That's why the exam and the consultation is really important. And that's why, and you experience this firsthand, like, taking that all under one roof and factoring it into the equation, that's where we set the expectation. And if the patient feels like that's a good one for them and we reach it, then that's a successful surgical outcome.
And how long would you expect, and this might vary with the age that you're doing the facelift as well, how long do you expect a facelift to last?
So
And does it
this
vary
study
with
came
the
out
age?
actually. Yeah, so it does vary with the age. The younger you are, the longer it lasts. Okay.
Mhm.
And again, there's no perfect way of quantifying what does it mean that a facelift lasts. Usually when we do these studies, we're looking at the second time that they come in for a surgery. So the patient is making the decision for themselves that the facelift is no longer lasting. Or sometimes we look at patient satisfaction and we just follow them to say, are you still happy with your facelift or not? So hard to answer that question. You talked about how it was important for you when you picked me that I'm an academic. And I really think it's so important to objectively look at the data when we talk about cosmetic medicine. And, despite so many great journals being out there in our field, like, our research is kind of crap. That's the truth. Like, we're relying a lot on, one person's anecdotal experience, and then everybody follows that person if they like their results. So for me, the science is really important. And that's why, it guides every decision that I make when it comes to surgery. So the science shows the following. It shows that if you do a facelift in your 40s, I think it's before the age of 50, it generally will last you about 15 years, versus if you do it after 50s, it lasts anywhere between 11 and I think it's 12 years. So a little bit less than that. But again, that's highly variable for the person, their overall health status, what their anatomy is before and after the surgery, how well they maintain the result. So the last thing that I'll say is, There's a lot of great studies out there that show, the biggest predictor of patient satisfaction after facelift surgery is the ability to maintain a stable weight. And if you can keep your weight stable, then your result will last for longer too.
Yeah. So relative to a couple things that happened during the surgery, and I know we talked about this, I think you even have a video on it. And that I went in and I was like, listen, I'm going to be your cleanest case. I've never had fillers. I would imagine most of the people that you work on have had fillers or threads or Sculptra and things like that. So I was like, this is going to be super clean for you. But you actually found quite a bit of scarring when you went in there. So I think a lot of the questions that I'm getting is Sculptra a non-starter? Is filler a non-starter? Like when you get those types of treatments, how bad, like how does it affect you in your work?
Totally. People are not going to like this answer, but it depends,
Yeah.
obviously. I do tons of Sculptra in my practice. I love it as an injectable treatment over hyaluronic acid, but that's just my own preference. The way that I inject Sculptra, we had a training session on it recently, so we'll probably do a video on it. But if you inject Sculptra into planes that are safe for surgery, i.e. planes that you're not, dissecting later on in surgery, which is the plane you're supposed to inject it in, which is the subcutaneous superficial fat compartment, you're going to be safe. You're fine to do a facelift surgery after that. Now, it might be a bit difficult to get, under the skin in the first couple of centimeters to go underneath the muscle, but that skin's going to be removed afterwards. That's the beauty of preservation facelift surgery. So Sculptra generally is no problem if done in the hands of somebody who knows their anatomy. If you do have Sculptra, in general, we do recommend waiting 2 years afterwards, because we do know at that point that most of it, if not all of it, is out of your body. And so surgery might be, a little bit less challenging for that reason. Hyaluronic acid, again, I have no problems with filler if it's done tastefully and in, relatively modest amounts. It all depends where the filler is placed and what surgeries we're doing. So oftentimes we are dissolving filler in the under eye region or in the midface region, not just because we're doing surgery there, but also because it swells like crazy afterwards. So in general, I will recommend dissolving filler in that region. Now, the issue is, many people will come and say, but I had filler placed 9 years ago. Like, there's no way there's filler there. And the truth is, the longer ago you had your filler placed, the higher likelihood that it actually is still there. And that's because the fillers we were using 10 years ago were heavily cross-linked. They were stronger, they were more resilient. And so they last longer. They are more likely to have caused scar tissue. Again, my job here and my goal is not to fearmonger. I don't want to scare people. Surgery is not impossible in any context whatsoever. It is just more challenging. It takes more time.
Yeah.
And then the big one, which is radiofrequency microneedling. Again, it's highly variable. I've said this publicly. This is a bigger form, but I'll just say it again. I was hired in the birthplace of one of the radiofrequency microneedling devices, the most famous one. And so I personally have more experience using that device than most people around the world. And if I'm going to sit here and say that I just don't believe that, number one, it works. And number two, I also feel that if used in incapable hands, it can cause damage and further consequences for difficult surgery, then, you can believe me or not. I'm just speaking from a lot of experience. So, yeah, I'm not going to speak about your case. You can disclose that because it's your personal information, but I can expand on that further if you want me to.
Yeah, I mean, for those of you that might not have followed my journey, I've been very, very open that I had a procedure. It was probably about 2 years ago, and I had microneedling RF. In fact, if you've seen it, I actually have a whole series of videos on it, and I blew up. Like my face looked gigantic. I was like really worried, and I've been very open about my journey. We do a conference every year, and at every conference, I always say microneedling RF, I think, can be so damaging to your skin. And I always felt like it had something on the left side of my face that almost left like a little dent, like they melted too much fat in that area. So I always thought they were too aggressive. And then, so I told you that, and you didn't know which side I was talking about, obviously, but you said that you can expand on it, but that is basically where the scarring would have come from.
Yeah. I mean, the second we went onto your left side, that was the second I recalled our conversation about one side being affected more, and then realized that it was definitely the left side. So, what happens if we see trauma or a scar in surgery? Not much, frankly. What it just means is the tissues are a little bit stickier. So, if we use the analogy of, I often say this, your face is like a sandwich. It has multiple layers. And somebody who's not had any treatment before, you basically qualify as this. We call it a virgin face. This is a, ham and cheese sandwich that, is not grilled or has not been prepared or heated in any way. You can peel each of the individual layers, no problem. Very easy.
Yeah.
And somebody who's had those tissue planes scarred down together, heated up, fried, ultrasounded, whatever you have, it turns into a grilled cheese sandwich. So it's not just that the bread is more difficult to pull out. When we pull things apart, cheese goes in one direction, it goes in another direction. It's just a bloody mess. Okay. So, again, it's not the end of the world. As a surgeon, I'm trained to take care of this stuff. So,
Right.
This is well within my wheelhouse. And just as you alluded to, it's quite rare to operate on somebody in today's day and age that has not had any of these treatments at all. It's always something that we're cognizant of and aware of. So, what that means is we just slow down, we take a breath, we say a couple of swear words, a couple of prayers, just kidding.
Yeah.
And we just go and we do what we want, we need to do. And, if there are surgeons listening to this, which I'm sure some are, like, this is where your instinct as a surgeon kicks in. It's not just about using your senses of sight. It's about using your sense of feel. There's just this intuition that you build over time where you have this pattern recognition and you know where things look normal and where they don't. And it's so hard to explain, but all that ends up meaning for you is that I just take my time. I'm just more careful and we're still able to carry out the surgery. No problem.
Which your plan was, because you probably thought I was the ham and cheese sandwich from everything that I had represented to you. Your plan was to actually be like a 5 to 6 hour surgery. And it actually ended up taking you over 8 hours, probably because you ran into something that you hadn't accounted for and had to take that time. So obviously you're trained to work around those issues. It's just taking the time to do that. Hi, you guys. Oh my God, so many of my friends are on here, my TikTok family. So it sounds like, I think your answer is probably going to be the same on all of it. But, when you're talking about microneedling, RF, Sculptra, ZERF, any of the fillers, like if someone wants to get filler to kind of get from here to there, what's the best filler for them to really go for?
Again, it's so hard to answer that question, but what's the best filler? It depends what the problem is, right? So, this goes back to the first thing we talked about, you and I, is what's the indication? Like, let's not start with the product. Let's start with the concern of the patient. And so the only way to determine that is to talk to the person and understand what their goals are, right? So, I place filler still in every part of the body, depending on what the person's concern is. Again, it touches on all the themes we talked about with surgery. It's about patient selection, it's about indication, and it's about restraint. You have to understand the limitation of the device that you're using. And so if somebody is coming at you with a needle promising a facelift result, you should be out the door before they even squeeze the syringe, right? So, indication matters. To be clear, radiofrequency microneedling is probably one of the best treatments you could use if done at a very superficial depth to help with skin, maybe a small amount of skin contracture. It's not going to lift anything. It's not going to achieve a facelift result. It's not a gap procedure where they promise it to be better than filler and less than a facelift. Like, that doesn't make sense. Okay. I often think, I'll just use one anecdote. I often think of the fact that, people at one point we were in a health craze in 2017. I was training in Cleveland and the Impossible Burger came out at that time. So people didn't want to eat meat anymore. So they invented this artificial meat alternative. And that's how I think of as these treatments, is they're trying to fill a gap that might not even exist. And it just so turns out that the Impossible Burger, I hope they're not on this chat, but I don't want to get sued. I'm not talking about Impossible Burger, but whatever it is, it turns out it's actually less healthy than having the real thing. So there are downsides to these procedures. And I will often say this because I get flack. I'm a surgeon. I talk about surgery on social media. People, they point the finger and say, you're a surgeon. Of course, you're going to convince people to have surgery. That is not my goal. My goal is to say, if you are not a surgical candidate, don't go for the Impossible Burger. Just don't do anything. Sometimes saying no is the right thing and just doing nothing is in your best interest.
Yeah. How do you feel about threads?
I feel a whole way about threads. I don't think there's any circumstance in which threads are helpful. Unlike some of those other things we talked about, threads do nothing. If you saw me in hour 5 of a facelift, there's sweat running down my forehead and I am actively engaged in trying to peel apart tissues and use all of the tools that I have in my toolbox to get the result that I want. I'm sorry, there's no little filament thread that's going to achieve that in a 30-minute procedure. It's just not possible.
Yeah, it's good. I looked into it. I mean, that was a real possibility for me to just get a quick little tuck. I'm so glad I didn't do it. I didn't know anywhere near what I knew then. Like then, I didn't know what I know now. I'm so glad I didn't go through with it. And I only didn't go through with it because they weren't going to put me under and I just wasn't going to deal with the pain.
Good. I'm glad you did it.
But speaking of, oh, so let's talk about surf before I say speaking of, because everyone wants to talk about anesthesia. Everybody, I think, has the same fears that I did. So,
Yeah.
but Zerf, that's kind of the next big machine that you're hearing about
Yeah.
right now. And it
Yeah.
really is being advertised as like the alternative to a facelift.
Yeah. I don't have a lot of experience with it. And again, my goal today is not to fearmonger and just dismiss every device that's on the market. All I would say is if anything new comes on the market and you want to know if you are a candidate for it, number one, you need to have a consultation with the provider. You need to understand a couple of things. What are they trying to treat? What do you want treated? What can the device achieve? And like more often than not, you're going to feel like they're selling one device for everything that you're complaining of. And that's just not true. And we just talked about how surgery can't achieve, volume restoration. We use fat transfer to establish that. So, there's just not one thing that solves all of our problems, even a facelift. So I think at the end of the day, people are smart now. There's a lot of education out there, thanks to people like you on social media. We're very savvy. So if you ask the right questions, you can tell who's being a medical practitioner versus who's being a salesperson.
Yeah, for sure. So let's talk about, well, first of all, there've been a couple of comments about brown skin. You don't have many before and afters about brown skin, has been the comment. Do you work on brown skin? And how do scars look for brown skin? Those have been the questions.
Listen, I live in Toronto. It's literally the most multicultural city in the entire world. We have people, 50% of our city was born elsewhere. So do I operate on people of all skin types? Yeah, absolutely. But we are very restricted in the photos that we can share online, and that's partly regulatory, but out of respect for my patients, I don't show what I can't share. Of course, I would love to show everybody. So if somebody has concerns about that, come and have a consultation with us. I have consent to show lots of those photos in consultation. So I think that's the first thing they should know. Number two, as far as scarring is concerned, yeah, there's multiple factors that will contribute to a good outcome with respect to scarring. First and foremost, it is technique, but I think overriding that technique is the surgeon's ability to carry out that technique and to be very meticulous. So you can do, a deep plane facelift, but there's no such thing as one universal result from a deep plane facelift. It's really the surgeon that's doing it. So that's like number one, first and foremost. And number two, there are genetics involved. There are some skin types that don't respond well to being cut with a scalpel. So we can never guarantee that scars are completely invisible after surgery, but I would say far and above the expected result from a facelift surgery is that the scar is hidden within contours in front behind the ear and should be so inconspicuous that unless somebody's standing at you with, your ring light's better than mine with a very bright ring light, nobody should be able to tell that you've had it.
Yeah, no, and my scars are, actually my son was looking at it today. He's like, the inside of your ear scars are so completely straight. Like you can tell that it was like so beautifully stitched. So I'm really excited. And honestly, as far as where my scars are, the only visible scar that you're going to see is going to be this little loop right here. And honestly, there were some surgeons that I had a consultation with that had much bigger scar patterns. And I really wasn't interested in that. So that was a really big deciding factor for me as well. And I got a lot of feedback that you were a really good stitcher. So that came really well. Oh, I got to hold on a second. That's making me test this. So relative to, one of the things that really kind of comes with the surgery, right, is the CO2. And I elected not to do that. And for me, it was twofold. It was, first of all, I knew that I was going to be completely overanalyzing everything afterwards. And I didn't want to bring too many factors into the play, nor did I really feel like I needed to burn off a layer of my skin because I was coming into it with a pretty good skincare regime. So I ended up going for the halo. Yep. Do you recommend the CO2? Do you recommend not the CO2? Like, how do you go about it when you have a patient who's basically saying, like, what comes after the facelift?
Totally. 2 weeks ago, I had a patient who turned to me at the end of the consultation. She said, Dr. Roskies, you've recommended all of these things to you. But if money was no object to you and you could do anything in the world, you could use any laser on me to get me the best result in the world, what would it be? And I think she was actually like offering to buy me a laser, and those things aren't
Yeah.
cheap. And I
Yeah.
thought for literally a split second, I turned back to her and I said, I feel like I have every tool that I need in my toolbox. So, that's the beauty of my practice is I've really done, even when I couldn't afford those lasers, I was buying and financing those lasers because I feel so strongly that the skin and the face have to match one another. And
Yeah.
so if it is somebody who's got a darker skin type, Halo is under a group of lasers called erbium lasers. It's a different wavelength that doesn't emit as much heat. So for darker skin types, it's a very safe laser to do if used under the right settings with the right practitioner. So we love Halo in our practice. For me, this is like one of the best lasers that you can do without having to undergo anesthesia or sedation anesthetic. And I've done it a number of times for myself as well. Like Halo is probably the standard. CO2 has different benefits. So CO2 emits heat. It allows the skin to shrink a bit more effectively. So for me, when I'm doing a facelift in really anybody over the age of 55 years old, we're trying to get the skin quality to improve just as much as the skin quantity being removed. And so the big target there is the under eyes. I don't like skin pinch surgery where we're removing a sliver of skin under the eyes. It's just not my practice. I don't like the way that looks or heals. And so CO2 laser really does help shrink the tissues in that region. So that's why I love CO2. It's a combination. I'm almost always using a cocktail for all of my patients, depending on their skin type, but also the facial zone that we're targeting.
Yeah. And I know for us, it was a compromise. I was like, I want nothing. And we were originally talking about a CO2. And I remember calling up and I was saying, I don't want a CO2. And then we're like, all right, let's just do a laser. It just kind of gives you that like fresh, which I had a laser before. So I knew I would bounce back really quickly. So that wasn't going to be something I was going to be afraid of. So for me, that was a very comfortable choice for me.
Listen, it's a big reason why your recovery has been so seamless and smooth. There's no doubting that laser adds quite a bit to the look of the way people recover, and it can be a little scary, especially in the first few days. But, at the end of the day, and, you and I were talking flippantly about lasers because people should know, like, we throw it in. We don't charge for laser. That's how strongly I believe. This is for everybody, not just for you. This is for everybody. I haven't charged for laser since literally the first day of my practice, if done in combination with a major facial rejuvenation case. And that's because, again, I want the skin to match the face.
Yeah, absolutely. So let's talk anesthesia. And this was one of my biggest fears going in. And I always told him I didn't want to wake up. Like one of my biggest fears was waking up in the middle of surgery and having that memory. Like I didn't think that was something that I was going to be okay with. So we talked, and when was his name Jonathan, right? Was the anesthesiologist? Joe. When he came in and talked to me, he was like, you can go all the way under with the tube, or you could do the twilight sedation, and we'll make sure that we give you some kind of amnesia medication so that you don't remember. And I was like, I don't know. Like, I'm not comfortable with that one, and I'm not comfortable with the tube because I didn't want to get in the way of what you were doing as a result. So I know he went and had a little conversation with you, and you guys agreed to, I think, twilight with deep sedation.
That's right. So you had a cocktail of medications called total intravenous anesthesia, TIVA. So, it's a gradient, right? The difference between a deep sedation and a general anesthetic is really the dose of medications that we give you. And once we get to a certain dose, a deeper dose of medications, you lose the ability to breathe for yourself. So we have to intubate you. Okay. So that's really the big differentiator between the two. One of the better benefits of doing surgery under sedation anesthesia, if we can get away with it, is that we don't use any gases. Gases typically will stimulate different blood pressure responses for patients, but also quite a bit of nausea afterwards. So if we can avoid an intubation, if we can avoid gases, giving you nitrous oxide or other types of gases during the surgery, then typically the recovery is better. And just as you said, the tube in the way it's a nuisance. It is a pain in the butt, but at the end of the day, again, just like with all the non-surgical stuff, we manage. It's not the end of the world.
Right. Oh my God. So many people are like, I need to go to this doctor. He is great. People do want to know, how much is a consultation with you?
So consultations, this is good. By the way, just so you know, I had to have a refresher with April today because I'm not lying when I say I have no idea how much things cost in my practice because our pricing is reflective of our wait list and our wait list alone. And what I mean by that is We're just trying to get people in a reasonable time for surgery. And so what that ends up meaning is once we get to a specific waitlist length and it's there for 90 days, we bump up the price by 3%. So my prices are not going up by $50,000 tomorrow. That's going to be a very long time from now. My goal is not to cash in and to make more money. My goal is to allow people who are serious about surgery to have it in a reasonable time frame. And the only way of gatekeeping that is by going up incrementally on the price. That's just my honest disclosure to start off with.
Oh, Dr. Mark Levin's here. He says you're his mentor and a great
I
friend.
love Mark. That's the future of facial plastic surgery in California. People should follow him. Great
Oh,
guy.
that's amazing. He reached out to me early on.
He's the best.
He's got a great page. Yeah.
Yeah. Okay. So consultation price is, these are all in Canadian funds. People should be aware of that. So in Canada, we're 40% cheaper than the American dollar. And I only say that because
I think it's 30%.
Again, I don't know anything about money, but it's very possible.
Yeah.
So $750 for the consultation. It is fully applied towards surgery if you decide to move forward with it. So again, facelift surgery is not even offered in my practice. It's full facelift, which is brow, temple, and face and neck lift. So these are 4 separate procedures in combination. If I'm not mistaken, you can correct me if I'm wrong, Christina. It says it on our page. I think it's 70 or 75,000 Canadian dollars. So that's what it starts at.
Yeah. So I very openly, my surgery was, I think it was quoted at about 88 or 90,000 Canadian, which I ended up paying, I think it was about 70,000 US. And then everybody has the option to add on aftercare or hyperbaric. And I think you have some other care packages with red light and things like that. So that's kind of the frame. So I basically said you could go, for US dollars, I've always said 70 to whatever else you add on. And honestly, that's based on my procedures, which I'm sure would be different for other procedures. So, so that's what I did, and I've been very open about that on all my posts.
Yeah. 75,000 Canadian, I had to look this up, is $53,000 US. So that's the starting price for brow, temple, face, and neck lift in our practice.
And that doesn't include fat transfer and some of the other add-ons.
Correct.
Yeah. And then, what else was I just going to ask you? So relative to anesthesia. So one of the things that people are saying is, I'm so scared of not making it out of the anesthesia. And that was one of the questions that keeps coming up. Like, how do you get over that fear of what if I don't wake up, or I'm so scared of going under? Yeah.
I think people need to understand that, medicine is not really like they portray it on Grey's Anatomy. You're not only going to wake up from surgery, but you're also not going to wake up and be paralyzed and feel everything and not be able to communicate with the surgeon. Okay. The reason why that has happened, in very small reports all over the world is because, in abdominal surgery and other surgeries, they're using paralyzing medications so that your abdominal muscles are not contracting during the surgery. We don't use paralytic medication. So in the worst case scenario, if you have a little bit of a lighter dose of sedation anesthesia and you wake up a bit, you move, we're going to know that you're awake. So it's not like things are happening when you're kind of under that veil and not able to express yourself. So, anesthesia in 2026 is extraordinarily safe. Okay. We have board certified, and this is the way it works in Canada. You need board certified anesthesiologists. In other parts of the US, you can have CRNAs or other staff that assist with anesthesiology. In Canada, we are so scrutinized and heavily regulated in private hospital centers that we have no choice. So we have board certified anesthesiologists there for every second of your case. They're not going out for coffee breaks. They're not managing 2 ORs simultaneously. They are there for you and you alone. So, that alone adds a huge safety parameter and should reassure people. But, even if it wasn't, and if you're in, somewhere in the US and a CRNA is providing anesthetic care for you, that is also extraordinarily safe. If somebody is trained and they know what they're doing, this is not the type of thing that, terrible things happen. And we hear that from time to time. And often it's not a reflection of the dose given of the anesthetic or, the improper care that the anesthesiologist or doctor provided, it's really negligence in the screening of the patient. It's not, monitoring and making sure they've done their bloods and their EKG and all the things that we need to make sure that they're healthy. And the reason why bad things don't happen in our centers, at least in Canada, is because we're extremely strict on who we accept to have surgery in our centers. You really do have to be healthy. That's just the reality.
Yeah, that's amazing. So you're building a new facility. So you're moving into a 7,000 square foot facility. I told my husband we're going to have to get an apartment in Toronto.
You come anytime. We'd love to have you.
I'm gonna be knocking on your door like, you guys, I'm back.
Anytime. Anytime.
Well, especially because you're doing some other services as well, right? You'll be doing some of the more cosmetic services.
Yeah. So, we talked about this as well. I'm not that surgeon that thinks I'm holier than thou and what I offer is better. The truth
Yeah,
is, everybody comes in at different stages of life with different expectations and different desires for their face and their body. So, I love non-surgical treatments. I think if
yeah,
done again with restraint, with taste in the right person, that's part of the plan. That's part of,
right.
that health maintenance and beauty maintenance plan. So, yeah, I'm really excited. We're offering a whole slew of treatments. It's not just going to be a standard med spa. We're hoping to have a membership club as well, where we're offering express facial treatments for people to just book and get same day appointments so that they can get,
Wow.
their Botox without, jumping through hoops and having to do stuff if we know you, of course. So that's kind of the idea is we're really trying to modernize and lower all of that friction that people will experience in healthcare in general, but even in the med spa industry as well.
That's amazing. So lots of questions about revisions, whether you do them.
I do. I do a lot of them. I've gotten a lot of revision requests recently, and I blame you completely. Um,
I'm sure.
so
I have a
before
lot of
all
people
this,
reach out to me and ask me if you do revisions, and I'm like, I'm quite sure he does them.
yes, I do a lot of revisions. It's a it's a
April's on
sensitive
here.
topic. Where's April? There she is. Hi,
Yeah.
April.
Hi, April.
You should be
April's the
on
first
this.
person you talk to when you call in. She's so amazing.
April is the boss. She's the best thing to ever happen to my career, and besides my wife, the best thing to happen to my life. And she takes care of everything. She's
Oh,
just the
she's
best.
amazing. She checks in on me all the time. When I'm having a little panic moment, she calms me down. She's great.
Yeah,
Yeah.
yeah,
If I
she's the
can't find
best.
someone at your practice, I hound her and she goes to hound them.
Yeah, yeah. She's probably working now. She's probably taking calls right now. It's 8 o'clock here, so
Yeah.
I'm surprised she's jumping on this. It's okay. I'll
Yeah.
allow it.
His Miriam's
Um,
my home manager, and she actually helped me with the research. She's from Brazil, and in Brazil, surgeries are like dinner. Like
yeah,
everybody gets surgery. And so she actually had like a couple of her Brazilian friends check you out. Like I'm
wow.
telling you, I like tried everything to rule you out before I
Okay.
decided on it.
And look at us now. Look at us sitting here.
It's so awesome.
Mhm.
Um, so you do revisions. How do you feel about, I obviously went over the border to Canada. My
Mhm.
personal preference was not to go to Mexico and some of the Turkey and some of that. How do you feel about those types of international, facelifts in Mexico, Turkey?
Listen, it's the same thing as Canada. There are excellent surgeons all around the world, and there's some not so excellent surgeons, right? So
Yeah,
at the end of the day, I'm just not that guy that paints a brush across a country or a demographic. Like some of the, best surgeons in the world for rhinoplasty who have taken almost all of my technique from are in Turkey. They're amazing surgeons. Some of
yeah,
the best surgeons in the world are in Mexico and South America, like all over. Everybody has something to offer if they're mindful, if they follow the science, and if they bring some good artistry and great patient care. So, it's really a question of doing research on the surgeon, not necessarily the country itself. Now, that said, there are businesses in some of those countries that sell you procedures and not surgeons. And that should really be the
yeah,
biggest red flag. We get lots and lots of revision inquiries from people all over the world who have gone to some of those countries,
yeah,
literally as if they were buying a pair of jeans, just putting money down to say, I want a facelift. And oftentimes they're meeting the surgeon like literally seconds before they're undergoing the knife. Like
yeah,
this is a very personal decision for a lot of people. And it really should not be treated as a commodity that you can just buy off the shelf. So, again, some people do like that, and some people have great results by going that route. It's not the way that I like to carry out medicine.
yeah. So what would be a person that you would say you're not the best fit for?
somebody who's trying to have a part of their body look like an animal. I'm just not the cat eye guy or the fox eye guy.
Yeah.
I respect people's native anatomy. So, if you want, again, an exaggerated, heavily operated on look, then I'm just not the guy for you. And that's okay because there are lots of surgeons who will do something like that. But for me, like, I just want to be really proud of my work and I really want to build strong relationships with my patients. So, it's like going for coffee. You just, right away whether or not it's going to be a good fit or not.
Yeah. And for me, that was a big thing is I really needed someone that was going to make me look natural, but like really work on that enhancement.
Hmm.
You know what I mean? Like
Yeah.
you do want to feel like you look like yourself, but you also want to feel like you did something, right? You don't want people to
100%.
be like, "Oh my gosh, like I can't even tell you didn't had anything done."
Yeah. Neil Gordon, who's on our paper, he's a one line god. He says that at every conference. He says, everybody wants a conservative result until they get one.
Right.
And
Right.
so, people are so afraid of looking different that they say, please just make it look natural, be conservative. But what they're really saying is, don't make me look like a crazy person.
Right.
And there's not a fine line between looking good and natural and a crazy person. Like, if you look like a crazy person, somebody tried to make you look like a crazy person. That's really
Right.
what it comes down to. Yeah.
Yeah. Is that $750 consult in person or
In person or
on video?
virtual. Yeah, either
Oh,
or.
either one.
We see people, virtually all the time, all over the world, which is one of the best parts of my job. That's really fun to do. But oftentimes people who are traveling in from very far will do a virtual consultation. And then depending again on what the timeline for surgery is, they might come in the business day before for me to meet them in person, examine them, fine tune the plan. Or sometimes they come in 2 months before surgery during their preoperative consultation for me again to examine them and for them to make their final decision. So,
Yeah.
obviously, we encourage people not to come in 7 times to do a consultation before surgery. Usually after two, they're able to get the information they need to make the decision. So, oftentimes it's 2 consultations if necessary.
Yeah. And how far out are you booking? Quite a few people are asking.
April will be able to answer that question, but I honestly have no idea.
Yeah.
We went through it today. I think there's like maybe a handful of dates for 2026 and 2027 is booking out pretty full right now too.
Yeah.
So I probably should have gotten that information before I jumped on this call, but I don't
Yeah.
know. I'm sorry.
No, that's great. And a couple of questions. Let's talk about skincare for a minute, because some of the comments that you get are because I've talked about skincare a lot over the last couple of years in this app, and it's really become an important part of my platform to help mature women create really strong, resilient skin with incredible skincare. Which I'm glad when you looked under the covers, you actually saw the merits of that. But some people will say, so all the skincare that you didn't work if you needed a facelift all along. So
Mhm.
talk about the separation and how important skincare is to the facelift itself.
Yeah, totally. There's a huge difference between skin quality and skin quantity.
Yeah.
Facelift surgery improves and removes the skin quantity, but it has zero impact or effect on the skin quality, right? And again, this is why, ever since you started posting, it's only 2 weeks, but we've seen, quite a few patients, both during surgery and in follow-up since then. Everybody wants to know why they haven't healed like Christina.
Okay.
You've set the bar. Of course, I explained to them that this is, I know it's a hobby for you, but it's almost as if this is your job. At the end of the day, you take skincare so seriously that even though there was a little bit of doubt, how you would heal, we both knew that you were going to heal really well very quickly, not just because you're in great health, but because you followed everything to a T, and you've really taken care of your skin. So skin quality is the big differentiator. We're actually working on this now, but if we publish like a guide, not just like a how to prepare for facelift like the day before, but like 5 years leading up to facelift surgery, what should you do? Skin is the focus for 95% of that.
Yeah.
And if you can really build up your collagen reserves, if you can make your skin resilient and thicker and build the elasticity to it, then there's no question that both your short-term and long-term recovery from facelift is going to be great.
Yeah, no, I was so excited. And I think you had it in a video that, you normally don't see skin this thick. And honestly, that's
Mhm.
not an accident. It's not genetics because
Yeah.
3 years ago, my skin looked nothing like this. It really is that methodical consistency, great products, using them in the right order. And honestly, it's nothing surprising. If I did a guide, it would be an encapsulation of everything, all of my videos.
Yeah. We got to
Um,
do a guide, Christina. I think there's an idea there.
I know, I know. We were just chatted about it before you hopped on. I was like, this is a case study because
I know.
honestly, like if people want that type of recovery and that type of outcome, I think they need the same type of partnership where you come into it. And honestly, like I sat there in their office, I think it was you and Lana, and you talked about, 3 weeks and 5 months and 6 months and stuff like that. And I was like, hold up.
Yeah. Yeah. Yeah.
I'm going to
Watch.
be your best recovery case ever. I've been preparing
Mhm.
for this like an athlete.
Yeah.
And so I came in with the mindset of in the preparation now, and obviously things could have gone wrong, but this was what I was hoping would happen and what I planned for it to happen. So when people,
Yeah.
and you said, I'm actually afraid to post this type of progress this early on because everybody will expect it when they haven't done the work.
Yeah. At the beginning, I said to you, it's just not realistic to post that, but you've made it real, and I don't want to, again, set the expectation for anybody that this is normal. This is in no way the expectation. You are a super healer. You have healed well above average for, anybody undergoing facelift, frankly, for the procedures that we did for you. Sometimes it is just luck of the draw. A lot of the times genetics comes to play, but I think
Yeah.
oftentimes, and we've come to realize this pretty recently, like, we really shouldn't diminish the work that our patients put in both before and afterwards to get them where they need to go. It is like being an athlete. You got to prepare mentally, physically, not just before the race, but it's the athletes that can recover best afterwards that are the ones who rebound the best, right? That's just the
Yeah,
truth.
for sure. I don't know if you want to answer this question because I know there's a little bit of what do you advise on peptides? I've been very open about my peptide journey pre, and I have jumped back on peptides post. I don't know if you have
Mhm.
or want to state your opinion on that.
I don't think I can publicly. I'm interested in peptides. I think that that probably will be the future of medicine. It already is with GLP-1s. It's revolutionized, our industry and my practice specifically. So, again, as a man of science, I really want to stick to that and wait for, the Eli Lilly trials to come out and to be published before I state my opinion, because, I recognize the platform that you have and that you're giving me right now. And I want to be careful with what I say.
Yeah, for sure. I think someone misunderstood me when they think that they said that I said I'm an athlete. I don't exercise regularly. I should, but I don't. I meant that as more of an analogy. Like I was very regimented in how I prepared for it.
100%. Yeah.
So this has been amazing. I don't want to keep too much of your time. I know you have small children at home, and Marissa's probably like, "What are you doing?"
Yeah. Yeah.
But thank you so much. Like, what a
Thank
gift that
you.
you were able to jump on here. I know we've had thousands of people jumping through this live
Unbelievable.
and tens of thousands of questions. So it's amazing. Yes, I know you do men. So people are asking if you do men as well. Oh, and someone asked about microneedling. I think that's the last
Mhm.
question. At home
Yeah.
microneedling or microneedling in the office, which is
Yeah.
different from microneedling RF.
That's right. We often call things that are tried, tested, and true that have kind of withstood the test of time to be toaster treatments. Like the toaster hasn't changed its design in over 100 years because it works really well.
Yeah.
Microneedling is a toaster treatment. It's not sexy, but it does
Yeah.
exactly what it was intended to do. It was developed originally for treatments of scars, and they recognize that it builds up collagen. So I'm all for it. Obviously, you want to do it as indicated. You want to be careful with your depths. You want to
Yeah.
get good training on it. Frankly, I think it's better to do it in an office, under the supervision of an esthetician or a nurse. But if you do it at home, just make sure whatever you're buying is regulated and works the way that you want it to.
Yeah, that's amazing. Well, everybody is so appreciative and honestly so grateful. Your time is so valuable. And I have
Thank
so
you.
much respect for someone who can go into an operating room several times a week and be so completely focused for eight
Thank you.
hours. I mean, that is, I don't know how that happens. I'm like lightning in a bottle ideas all day long, but the
Yeah.
level of just focus and concentration that you put into your cases is just unbelievable. And I assume you do one case a day. I think I asked you that in the consultation.
Only one case a day, only 3 cases a week. And that's just the way I love it. And the reason why I can do it for 8 hours is because I love it. It really is my hobby. And I'm grateful for what I do. I'm grateful to meet people like you. And honestly, I'm so grateful for the conversation that you're starting, and that, people can see that facelift surgery is not going to make you look weird, stretched, wide, and natural. It's going to make you look like yourself, and you're living proof of that.
Which honestly, you and I have had some conversations about, right? I sent you a picture and I'm like, am I always going to look this stretched? Am I always going to look this wide? You're like, vitamin T, which still I'm like, vitamin T. I don't do well with vitamin T in any part of my life, but you do just need to like give it that time. So, my journey looks like it was so linear, but it wasn't without some concern and, some outreach to April, some outreach to you, some outreach to Lana to say, should I be feeling this? Is this normal? So I think that's part of that emotional journey. And I'll be doing a video on the emotional part of it, even though I think it probably wasn't as extreme for me as others. But I think everybody has doubts through the process.
100%. Listen, it's your face. You can't hide it under a t-shirt. It's one of those things that is so personal. And this is why, that match between surgeon and patient is so important, because trust doesn't just exist at the time of consultation, doesn't exist during surgery or after surgery when things are going well. It has to exist when things are not going exactly the way you want them to, because, that's what's going to guide you through to the end. And there's any issues, you trust that your surgeon will take care of it. That's just the reality of living human tissue.
Okay, so last question, and this one's more for me. So when this goes, 10 or 15 years and it's time for another one, what does that other one look like? Is it like a little nip? Is it a smash? Like, what are we talking about? Because now we're kind of like married for life in this lane,
We are.
right? So we're best friends.
I know you almost as well as Jason. But it's the same thing. I had a patient today say, why wouldn't you just do she came in for a revision. She said, why wouldn't you just do like a SMAS? It seems like an easier, straightforward procedure. And I said, I'm the pilot of this plane. I only know how to fly it at 30,000 feet. You don't want me to fly at 20,000 feet.
Yeah.
I do what I do, and I'm good at what I think I'm good at, because I do the same thing. It's just the reps, and it's doing it well, and it's getting better every time. So who knows? In 15 years, what's going to be the difference? Probably something. I think our technology and techniques will probably be a little bit better, but my hope is that I'm still at the forefront and looking at the science and being part of discovering everything we want to in order to make, results better and the journeys of our patients safer and happier, frankly.
Yeah. My daughter's 28 and she's like, I'm jealous of your neck. Like, when can he do my neck? I'm like, calm down.
I'm jealous of your neck. I want your neck.
I know. I do love my neck. It's my favorite part. You actually said it would be my favorite part. Because I kept saying, like, I need my V shape back. I want my V shape back. And I kept saying, like, are you sure you can get there? Because lower face heaviness runs in my family. Jowls run in my family. And you actually said, in spite of the fact that your skin was so good, it was more skin than you expected to take off from a laxity perspective, which is very genetic for my family.
Yeah, we're always surprised. It's often not a measure of a good facelift is how much skin you remove. It's really the contours that you can create. Sometimes we don't remove very much at all, and it still looks amazing. But I'm actually quite surprised at how much skin actually came off.
Yeah, which I'm so grateful. Which honestly, I'm not surprised, because it was almost like this was becoming disproportionately sagging relative to other areas of my face. So actually, I wasn't surprised when you said that, and I'm glad you took it. So,
took it all.
Well, thank you so much. We're so grateful to you. And it looks like you have a lot of people that have appointments for you already and are looking to make appointments for you. So I'm so grateful that people find you and, are willing to do that. I stayed in Toronto for 8 days. I think you recommend 8 to 10, just based on how people are healing. For me, it was fantastic. I'm an hour and 45 minutes away. I think I should just buy round trip tickets in advance so that I can
100%.
Get back and forth there.
Yeah, it's a reflection, by the way, of how long the flight is to come and see us. So, we did have patients say, how come she only had to stay for 8 days, but I have to stay for 10 to 14? And, if you're coming from the West Coast, there's a long haul flight. The last thing we want is for something terrible to happen mid-flight, which, by the way, will not happen. But again, we're being extra cautious here. So, if you're flying overseas, it's 14 days. If you're flying to the West Coast, it's 10 to 14 days, again, depending on where you are. So again, it's just customized to the person. Our goal is to be as safe as possible. We want you to get home to be with your loved ones in a familiar environment. So it's just a constant communication.
Yeah, no, I was trying to get back for the July 4th weekend. And I remember talking to April, and she had said 10 to 14 days, and I was negotiating
Yeah.
with her. And we would talked about the flight, and she said, where it's only an hour and 45-minute flight, you should be
Yeah.
okay as long as the healing was progressing
Correct.
appropriately.
Yeah, totally.
So
And if you have to stay longer, we keep you for longer. That's just the reality, and that's what my patients sign up for. They know sometimes we have to keep them for longer.
that's great. Well, thank you so much. And I'm sure I'll be texting you with what I'm panicking about tomorrow, and it'll be good.
I welcome it anytime, Christina. It's so great
Great.
to
Well,
speak
thank
with
you
you.
so much. This is a gift for us, truly, and we really, really appreciate it.
Thank you. Thank you. Have a good night.
You're welcome. Bye. So you guys, I am wearing my lift ring. Isn't he amazing? Like, honestly, you guys, that was such a gift. We will have that posted on YouTube. So, yeah, we're working, we really did just talk about like, how do we do a guide to really like make sure we take a look at this process and see how well it worked. But he is amazing. Yeah, for those of you guys who are just on, that was my surgeon. I'm 19 days out from a deep plane facelift. If you, he does, I think he does not use drains. He uses those cages. We should have asked him that. But yeah, he's very, very much like a natural educator. So the fact that he made the time for us is just a testament to he truly is a giving, kind person, which was actually very, very important to me. I looked at quite a few of those celebrity physicians or the big social media physicians. I walked away from people that had really big egos, even though they might have had stellar reputations. And I loved it that one of the things that he told me is, I learned something from every case. And I loved it that oh, you don't use drains. Okay, so that's Svetlana. Is that Lana? Oh, that's Lana. Hi, Lana. She says, this is Lana. She's actually a nurse. She's actually a doctor from Belarus. And she's incredible. She was the first face that I saw when I woke up. Lana, you want to hop on? I don't know if she can do a live, but they don't do drains. And I would have been open to them doing drains. I would have preferred not to do drains because my tummy tuck, I had drains and I hated them. Both of my surgeons have been amazing. You guys, listen, I research until there's nothing left to find. So they were amazing. He is incredibly kind. And honestly, I've always said, like, if I walk into an office and your team is kind, then I know you're kind. Because it all starts with the person who's really, basically setting the culture. And when I walked in, April was amazing. Lana was amazing on the checkup. Everyone that I met was just amazing. Microneedling, he said, is great, tried and true, and just a great. And honestly, you guys, listen, his testament to having thick skin, which made such a big difference in the result of the facelift. It really came down to daily exfoliation. It comes down to microneedling. It comes down to powerful actives that are creating that cell turnover and really making sure that your skin is getting thicker and thicker. Nurse Zoe's here. Oh, my girl, Nurse Zoe. She did my aftercare, you guys. If you go to Toronto, you have to get Nurse Zoe. She's the best. And honestly, that was such a big game changer. I'm so glad I didn't have my husband doing that stuff. Like, there are some things that you just want to kind of like keep private, and they were between me and Nurse Zoe. So he actually commented on it. He actually has a video on his website that talks about he generally doesn't see skin that's that thick at a 56-year-old level. I know, right? I mean, when someone actually looks at it from that perspective, because people will say, if you do this, it'll thin your skin and you're deteriorating your skin. Well, that's not like what happened at all. In fact, I had quite the opposite result. It actually proved that what we're doing works, and that's microneedling. That's great microcurrent devices. That's at-home radio frequency that's not going to damage your skin because it's controlled at that 40 degrees. The exfoliation, it really, really matters. So I love it that this was really our like legitimacy, which is amazing. I stayed in a hotel for 4 days. Zoe stayed with us for 2 days. And then I stayed with family after that, which was not the reason I went there. It just so happened that I have family that lives around the corner. Oh, Debbie, you're so sweet. So yeah, it really, yes, I will definitely. I just did a video on exfoliation. And I talked a little bit about like picking two exfoliants. I will do one that talks about what types of exfoliants I kind of used over the 2 years. But I will tell you on this app, there was a lot of controversy when I came out and started saying exfoliate every day, especially because I was saying exfoliate to your tolerance. But exfoliating every day is what changed my skin. So I know, Blissful Butterfly Girl, and look what it's done to your skin. So I'm not using any devices right now because I'm being so careful about my little baby fat cells. So I'm not using any devices at all. I'm going to wait a couple of months before I start touching anything, but I will be going back to, the Zip, the Niwa, the TMP, like those types of devices for sure. Hi, Carrie. So, right, Becca? So I'm so glad that you guys found this helpful. This has been an amazing session, I think, for him to really give you that knowledge. But I'm so happy with having chosen him, have found him, his team, and everything that happened. I think if I had to change anything, I would have kept the nurse 3 days instead of 2 days. I think that I could have benefited by that third day for sure. And I did a week of hyperbaric chamber, and then I did a week with no hyperbaric chamber. I would have continued doing hyperbaric chamber in the second week. I just started it up again. So yes, I still do use anti-age. I just started actives back up again. So my nighttime routine is anti-age always. So you're so welcome. I think I did a series of questions for consults. If you take a look at my facelift tab, and red light therapy, absolutely yes. I did red light therapy before so consistently, and I am doing face light therapy now so consistently. And I enhance it with, right now I'm using the Young Goose LADR serum. You can actually get that at chrismethod.com. But the LADR serum, which is light activated DNA repair. So it actually works with your mask. It actually works if you're going out into the sun, and it really engages at that level. So I'm actually, before I go to bed, I'm actually going to get out my mask, and I'm going to do red light as well. And I think honestly that contributes so much to your skin thickness as well. So yes, oh my God, Charlene, you need, what a game changer. If you aren't doing, red light was a really big piece of my skincare program. Oh, Zoe, she's so sweet. Zoe was there, and honestly, between her and Jay, it was amazing. And honestly, having a partner like Jay was everything. And he was just so supportive, told me I looked beautiful every day, even when I looked like I had stretched eyes. And so definitely have someone with you that it really is your support system. So the red light mask, I would say definitely 5 days a week for months before the surgery. I use the JOVS mask. We'll have it on our next live. We actually have incredible pricing on the JOVS mask for the next live. And the serum for DNA repair is at chrismethod.com, and it's the LADR serum. I think we might be low on stock on that. It's Young Goose DNA repair. It's pricey, so if it's pricey, we actually have the spray as well, which has the methylene blue and the NMN precursors. This is a really nice precursor too to your red light. This will enhance it. It's not as strong as the LADR, but it's a quarter of the price. Both of them you can find on chrismethod.com. So, oh, thank you, Debbie. Use Skin Age Reset first, and then you can use your Medicube toner after you do all your actives. Oh my God, Michaela, Young Goose is so good, isn't it? So we have a website that all of my really serious products are there. They're usually not on TikTok Shop, although a lot of products that I love and use are on TikTok Shop. But it's really going to be like the Neiman Marcus of the brands that are really results based and longevity based. So you'll find my top picks there all the time. We actually just launched Intoxicated Cosmetics to be there, which I swear I would have had a lot more than 1 centimeter off my bleph if it wasn't for snake eyes. That eye serum is the best ever. Literally game changer. And I know there's a lot of people on here that it's changed their hooded eyes. Renew Blue for red light is fantastic. So definitely that is a great option too. I know, wasn't that great? Amy, that was one of my favorite parts of the whole thing, is to know that all that work that you did really did matter. Like, and you always kind of knew it mattered, but you didn't realize how much it mattered when your plastic surgeon actually comments on it and says your tissues were really cooperative, your muscles were really strong, and it's all the facial, the crazy stuff that you guys see me do. It's the facial exercises, the at-home devices. You're constantly working the muscles and trying to really stimulate the tissues and, stimulating collagen. I think in his video he says, you could tell you've done a really good job of banking collagen. My first viral video was about collagen. So all the research that we do, you guys, and all the time that we spend working on our skin really, really, really does matter. You guys, I have slept, so I'm an insomniac, like an absolute insomniac. And, oh, is the chat hiding part of my face? An absolute insomniac. Ever since I did my PhD program, I've been up every night from like 2 to 5 a.m. And I have to sleep on my back, so you can't just pick up your phone. So I've been sleeping on my back like mummy position. And I will tell you, like, not having the distraction of the phone has had me sleeping through the night. So, yeah, honestly, that was my big thing, Sini. Because some of those big, big surgeons that are really, really sought after have a very heavy jawline. Like it's like a squared off jawline. And that was what I was trying to get out of. So a lot of people are like, what about this surgeon? What about that surgeon? I was like, I looked at those surgeons and they have too strong of a jawline. Like I wanted the Pilates, the ballerina jawline. I didn't want that type of strength in the jawline. And that was something I talked to him about very, very openly and like almost repetitively because it was such a big concern of mine. Yeah, Michaela, and you're seeing a lot of plastic surgeons do that. Almost like it looks like it's bulked up after the surgery. And so, everybody has a different technique, you guys. That's one of the things that I noticed 100%. Rhonda, we're going to schedule the live. I have to talk to Jules and Cass and see about when we're scheduling the next live. We'll be doing those like auction kits as well, which you guys loved with the Young Goose products and Sweet Chemistry and all that. So we'll schedule that in the next couple of weeks for sure. I just wanted to get over the facelift piece of it, but now we're getting, I know. Oh, thank Kara. Isn't it crazy? Like the way he changed my eyes is crazy. Like they're just so much more open. It's such a subtle difference, but they look so much younger and everything and this is without me wearing makeup. The spray for red light, it's called the Young Goose Peptide Spray. It actually has spermidine, copper peptides, NMN precursors. It's like a cellular, like steroids. So whatever you do after it, it really kind of engages your cells and creates more ATP, cellular energy. Yeah, I was really excited. A lot of people would comment. I get crazy comments, you guys, on some of these posts. And a lot of people were like, oh, he changed your look. I was like, listen, I'm 4 days out. I don't look like myself yet. Even now, like the swelling is still there. So I feel like I'm always like careful when I smile. So I put this on you. So first of all, I spray it throughout the day. So this is something that I kind of like use to refresh throughout the day because it's so good for you. But I'll put all my actives on and then I use it to start my saturate routine. So I'll spray this and then I'll use my Sweet Chemistry Duo. And this is so reparative. It's amazing. This spray is the Young Goose Peptide Spray. Again, you can get this on chrismethod.com. You can find all of my top picks on chrismethod.com. We're working on a couple of more brands that we're launching very, very soon. Oh, thank you. Yeah, Young Goose has a whole the Young Goose podcast is really, really informative. I'm still numb here. It's starting to come back though. I always feel tingling. So I'm definitely still numb here. I love anti-age. Yes, you can use this before red light. You can use the Renew Blue before red light. You can use the Ladder Serum before red light. The strongest one is going to be the Ladder Serum, but I think it is like $200. But it has methylene blue. It has the DNA repair. Yeah, I'm so glad. I think we have it for 10% off on our website. And if you're part of the Chris Method membership, which I'm actually just about ready to post a guide on everything that I did before, which I'm actually going to make available to Chris Method members. So if you are a Chris Method member, which is $25 a month, you get an additional 5% off You get access to our skin routine builder tool. So you can put all your products in, whatever your products are, and it's going to tell you what order you should put them in. It's a free tool for the membership. And we're going to be putting the facelift guide there, and you get points. And always out of stock. I think they might be able to put it on pre-order, but we get them in pretty much weekly at this point. Only 1%. Oh, okay. But it's 1% GHKCU. It's actually encapsulated, so that's going to be just as powerful as a 3% GHKCU. One of the huge influences. Oh, really? That's funny. I mean, I love the mothered formula. I'm so excited about it. But they're two different outcomes, completely different outcomes. So, Mafia Gang wants to co-host with me. So you guys, the new Remedy GHK, I haven't seen that yet. I saw a quick snippet of it. The website is chrismethod.com. And if you're a member, if you're a CEO Club member, boom. By the way, I love the way my jawline looks with my new hat. Look at this. Wearing a hat is my new favorite thing. I've never worn a hat before. The Chris membership is, so the CEO Club, it's $25 a month. You get an extra 5% off in membership credits. So whatever, we put things on coupon list codes. So whatever the affiliate code is that you would get, you don't need the code, we give it to you. So the Young Goose codes are 10%. All the Young Goose products are automatically 10%. I do use a stem regenerative serum. So we basically take Aonia, which is my ride or die. This is 20% off so we automatically price it at 20% off. So we basically don't make it so that you have to find a code. You'll get that automatic code. But if you're part of the CEO Club, we give you an extra 5% off. And you get access to an AI tool. It's the first of its kind that we built. It took a year to build. So many people ask me, like, can you help me with my skincare routine? This is the next best thing. You put in all of your products, whatever your products are, put in your whole suite of products. And you put them down in your drop-down menu in whatever order you want them in, and it will spit out a morning and nighttime routine for you. It'll say, here's your order. Also, you might want to think of adding a vitamin C. You might want to think of adding whatever. It'll make recommendations, but you could just go to the store and get a vitamin C. The AI tool, it doesn't help with cycling products, but if you, like some people use it every week because they get a new product. So they put it into the AI tool again, and then they put it in, it resets their routine. So that's how people use the routine builder. I know one person is actually using it and actually using it for her clients. And actually she's an esthetician and she's actually using it to build routines and then give it to her clients in skincare. And then, so it's incredible. We spent a year building it. I spent a year training it on making sure that you put your vitamins for your order of products is appropriate, that you're doing your vitamins first, your antioxidants, your peptides, your extra treatments. So that's what it is. I'm not wearing an Aura ring. This was part of my lift gift, the Cartier ring. So it's called the CEO Club, and it's at chrismethod.com if you're interested. But anybody can shop there. You don't have to be part of the CEO Club. But one of the things that we're just putting the finishing touches on is my pre-surgery guide, which honestly, you can get all the videos for free, but we've put it together so that people can actually download it. And it's basically all of my supplements, all of my peptides, all of my skincare methodology, my red light routine, like everything that I did before the facelift to get ready for the facelift. So Jules is already claiming the Cartier ring. I always ask them, like, what do you want when I die? Like, how do you guys want to do this? So fun. So anyway, thank you guys so much. I am still taking peptides. You're so welcome. Did you get that answer, Sandy? He said, if he does do brown skin, and you have to be careful with the way the scars come. And he was very confident about it. RF microneedling and thermage, absolutely no. Like, absolutely no. It caused a tremendous amount of scarring in my face. Also, Ultherapy, Morpheus 8, Lutronic, all of those, I think, are very, very dangerous. So I'm so glad you guys found it helpful. I was so lucky to find him, and I'm so glad to be able to share that with you and that he was willing to take the time to hop on. The AI tool is part of the membership. If you go to chrismethod.com, which is basically all of my premier products, we're actually building out a very boutique page of the best products. But no matter what products you're using, if you go on to chrismethod.com and you're a CEO Club member for $25 a month, which is $300 a year, you have unlimited access to our AI tool. There's a routine builder. You have extra discounts on products for membership credits. You get a point system that you get free deer serum, you get free sign-up gifts, you get birthday points. So you will get so much of your value. Then there's all kinds of specials, which I think today, if you buy I don't know if you buy anything or whatever, we're including like a free surprise gift and stuff like that. So honestly, it's like we really want you to feel like a VIP. We really want you to feel like a CEO. Like CEO is a big thing for me, right? Because you got to be the CEO of your life. It's not even just the CEO of a company. It's like CEO of your life. I did have to stop peptides before surgery. I had to stop it 3 weeks before. And then I started it about a week and a half, 2 weeks after. And I started the Klow, Klow. Other treatments, I love the Halo and the BBL. Those are really probably the only treatments that I would do is the Halo and BBL. And I think honestly, I do chemical peels. So I do so much with skincare. In fact, I'm not gonna do it now, but in a couple of months, I'll do a TCA peel where the skin really like peels off. But I am doing a TCA peel on my body soon. And this is the TCA peel, it's 30%. So I will be doing that. Yeah, I use the KLOW. Thank you so much. I'm so happy. I was so fortunate that I picked the right person, honestly. So I know I love TCA. It's such a game changer. But honestly, like I don't need major treatments because I really kind of get there through aggressive skincare. Thank you so much. This is from, I think Repair. I can't remember what it's called. Oh, repairskincare.com, REPARE, skincare.com. It's very inexpensive. I will do a video on how I make it more effective because I really started off with alcohol and then go in with this, especially with the body because the body has a much thicker dead cell layer of epidermis. So I will do, I have done the platinum one. I moved over to Repair. Yes, the best thing for microneedling is, and they're actually on our website as well, is the AU79 treatments. I love the stem cell treatment. Or you can go to AU79.com and you can get the refrigerated one sent to you, and you can use code Slaberhood or Slaberhood38. Cassie, are you here? Or Jules? And those I actually can't wait till I can microneedle because I want to get right to those. Thank you, Rossi. My roses is smashing it this week, Rossi. Wait till you see my video. All right, you guys, I'm going to bed. I'm going to put my little head wrap on, do my red light, and do all that. The website is Chris Method, ChrisMethod.com. Honestly, like now I look in the mirror and I'm still a little bit surprised. Like I look in the mirror and I'm like, oh, wait a minute. Like I had a facelift. So it's starting to fade a little bit now and I'm starting to get used to looking in the mirror, but it did take me a while. Like you look in the mirror, you almost have like imposter syndrome. Like I'm pretending to be someone younger that I'm not. So it does take a while. Oh, thank you, Greta. You're so sweet. But then you kind of like work into it. So, but I love this community. So supportive. It's been the most amazing part of the journey by far. So, well, I love you guys and I hope you have a great weekend. I'll hop on at some point during the weekend and just say a quick hello. And then I'm on again Tuesdays and Thursdays. We're doing a sub live on Thursday. So super crazy prizes because I've got a lot of PR to gift to you guys. I know water's so important, Debbie. Love you guys. Have an awesome weekend. Thanks for joining us. We'll talk to you soon. Bye. Oh, one thing, we're posting this on YouTube. So if you missed any part of it or you want to go back and revisit it, Jules and Cass are going to figure out when to get it up on YouTube. So it will be up on YouTube under Christina.noh13 on my YouTube account. So we post all of our lives on Christina.noh13. So if you want the Young Goose live or the Sweet Chemistry live or any of, Maya from Morgana's, all of those lives are on YouTube so that you can actually watch the whole thing. So love you guys. We'll talk to you soon.